very good source of monounsaturated, not monounsaturated, but polyunsaturated, low-fat content nuts. So I would say a handful of nuts a day. That's the best way. Rather than saying 10 to 15 or 15 grams or 20 grams, a handful of nuts. Ek multi nuts aapne khaya din mein, that is pretty healthy. That gives you antioxidants, that gives you monounsaturated fatty acids.
So you have mentioned that increase in whole grain. Whole grain. So wheat can be eaten in more quantity.
See, everything has to be in moderation. So the basic food pyramid, if you look at, is whole grains at the bottom. That is the staple diet. So in the staple diet, you have wheat, you have whole wheat. Rather than refined wheat flour, have whole wheat flour. Have soya beans, have chana. So these are the sort of things that will give you a low glycemic index. So you don't go from 2 chapatis to 5 chapatis. Maybe if you're having 2 or 3 chapatis, leave it at that. Increase the vegetables. Vegetables are free food as far as calories are concerned. So if you increase the vegetables in your diet, then, and fruits again, as somebody asked about mango also, how much mango can you have? Well, now mango, if you're having 1 mango, is okay. Now if you're a diabetic, then some diabetologists may actually say that don't even have mango at all. But most diabetologists will say you can have a mango. It has a lower glycemic index than many other sugary fruits. But at the same time, limit it, the quantity. So you have,
how much per? How much per? How much quantity?
1 mango.
1 mango.
But so that depends on your sugar control levels also. So if you are very poorly controlled sugar, then you may have to avoid that. But if you have a sugar control, you are on medication, you are doing everything else right, you can have mango.
So does stress also set fat liver?
Stress. Stress directly is very difficult to prove. I don't think it has any direct effect on the fatty liver. Stress has a significant effect on cardiovascular health by increasing the heart rates, by increasing production of certain cytokines, which has been shown to increase the risk of heart attacks. But directly on the liver, there is not much direct impact.
Stress ups your blood sugar levels.
That's what I'm saying. So it does have a hormonal effect in general. So,
sir, as you rightly affirmed, the thinking proportion is very important to the human being. I would like to add with you share, man शायर ने लिखा है, सोच बदलिए सितारे बदल जाए.
बिल्कुल बिल्कुल सही फरमाया.
सोच बदलिए सितारे बदल जाएंगे, नजर बदलिए नजारे बदल जाएंगे.
अरे वाह क्या बात है.
तथा किश्तियों को बदलने की जरूरत नहीं, दिशाएं अपने आप बदल जाएंगी.
अरे वाह इरशाद क्या बात है. So I think there's the other question I get asked कि exercise कितनी करनी चाहिए. So I will really express that 30 to 45 minutes of age-adjusted aerobic exercise. So I don't want it at 70 suddenly start going on a treadmill and fall down, but you can walk on a treadmill or you can walk outside. And at 35, if you are just going for a walk, चिड़ियों की चहचहाट सुननी है, मन को हल्का करना है, उसके लिए टहलना काफ़ी है. लेकिन अगर आपको actually exercise करनी है, then you got to be running, you got to be playing a sport which is active. And it should be regular. It should be regular, 5 to 7 days a week. The moment it becomes once a week, twice a week, it either dies out and it doesn't have the same benefit that one wants to achieve from exercise. Now, if you talk about drugs, the one drug that has been shown to help in fatty liver is vitamin E, and there is one very large study from Virginia, actually, from one of the Indian doctors, Arun Sanya, who's a good friend, which showed it decreases oxidative stress and it significantly decreases the inflammatory markers in the liver and decrease fat in the liver. But this study was limited to 2 to 6 months. It was also clear in more studies that if you increase vitamin E regularly for a long time, it increases all-cause mortality. So there are other mechanisms, it also causes some liver damage. So it is good as a relatively short to intermediate term things to help things get into the right direction. But it's not something we recommend कि आप vitamin E एक रोज capsule खाते रहो, because it's a fat soluble vitamin, it accumulates in the liver and it can cause liver damage and it can cause other problems also.
Vitamin E is found in which diet also?
Diet wise, actually, I would treat my ignorance right now.
Pistachio.
Mostly it is with fat soluble, fatty foods and things like that have some vitamin E. I'll have to check that. I honestly don't remember what are the actual dietary things. The supplements come as Evion. And at one point, especially in USA, there was this thing of mega size everything, including vitamins. So they were actually putting 600 to 800 units of vitamin E in some of these capsules, which then the FDA had to intervene to cut it down. So as a nutritional supplement, if you're just taking a supplemental dose, it's like 40 to 50 milligrams. The therapeutic dose that we use is 400 to 600 milligrams a day for a period of time, 2 months or 3 months or 6 months at the most, but not beyond that. Metformin is a drug that's very commonly used for diabetes, and it actually decreases insulin resistance, so it actually helps. So some randomized trials provide some evidence that it may help. It does help improve the inflammatory markers, immunotransferase levels, but and some incidence of improvement in necroinflammation. That means अगर हम biopsy करके देखें तो उसमें inflammatory cell markers थोड़े कम हो जाते हैं. लेकिन जब total study करके देखी गई कि भाई cirrhosis में incidence कम होता है कि liver biopsy now and 7 years later or 10 years later, there was no difference. So it is something that we do use to help, and especially if somebody has diabetes. But at the same time, we cannot say that this drug works great for fatty liver disease. Pioglitazones is another diabetes drugs, which again show biochemical and histological improvement. That means blood test भी better हो जाते हैं, थोड़ा liver भी better हो जाता है, and immunotransferase level better हो जाती हैं. But there is some increase in incidence of heart disease also, and in many of the Western markets now been withdrawn, and I think even in India is now gotten withdrawn or is going to be withdrawn soon. It is still available actually, but it is no longer used for diabetes very often. Every second doctor writes Udilip for anything to do with the liver. No benefit in liver disease. That's why I said it, no benefit, no benefit, no benefit. You're wasting your money for fatty liver disease. Udilip का usefulness is in cholestatic liver disease कि किसी को primary sclerosing cholangitis है, primary biliary cirrhosis है, bile stasis ज़्यादा हो रही है, वहाँ पे Udilip का usefulness बहुत अच्छी है. Fatty liver disease में कोई benefit नहीं है. LIV52, no benefit. So there is no medicine that is being shown to actually benefit liver disease. Now there is a lot of role we use Heptral, SAMe, nutritional supplements की तरह से, but a lot of it is placebo. It's sort of, you know, डॉक्टर को कुछ लिखना है, उसने कुछ लिख दिया, पेशेंट को कुछ लेना है, उसने कुछ ले लिया, लेकिन in reality उसका कोई असर नहीं पड़ेगा. So that is very important that please remember. So this is the bottom line. Multiple diseases are linked to common pathogens. So पुरानी कहावत है ना, लाख दुखों की एक दवा है. So वो लाख दुखों की एक दवा है. आपका diabetes, आपका blood pressure, आपका fatty liver disease, आपका heart disease, all that is heavily linked to your diet and exercise. And those things are under your control. Eat healthy, exercise regularly, avoid alcohol. Smoking, I think, is a poison. I would instead of avoid, I should say, do not smoke ever, because that is something that all it has is carcinogens, and carcinogens. It does not have anything beneficial at all. And people who are smokers tend to say कि इसके बिना काम नहीं चलता, but reality is that after a while it doesn't even give you the kick in the head that you're working on it. It's just a habit. Control weight. You'll then live a nice, healthy, long life with lower chance of heart disease, diabetes, and cirrhosis, lower disease of cancers and arthritis. So that's the other thing that has been proven. Increasing obesity increases the risk of many cancers, including colon cancer, pancreas cancer, liver cancer. Just obesity alone, without other risk factors, is a single identifiable risk factor for these cancers.
When is bariatric surgery recommended?
Right, so bariatric surgery is something that's now caught on a lot, and it has its place. So it should not be used as a panacea कि अच्छा कुछ नहीं हुआ तो surgery करा दें. उसके अपने side effects होते हैं, complications होते हैं, problems होते हैं. In people who have a BMI of above 35, that is where we consider bariatric surgery, because the downside of carrying that weight for long is a lot more. So the healthcare benefits can be in terms of decreasing your diabetes better, decreasing your, controlling your arthritis, controlling your heart disease risk. So those are the situations where we consider bariatric surgery. But again, the first effort is still, because I have had patients who have had bariatric surgery, 4 साल वेट कम रहा, उसके बाद बजाय प्लेन पानी पीने के, क्योंकि हम मीठा स्टमक की कैपेसिटी कम हो जाती है तो खाना नहीं खा पाते ज़्यादा, लेकिन लिक्विड ज़्यादा टॉलरेट हो जाते हैं, तो हम बढ़िया सा मैंगो शेक बना के पियेंगे रोज़, बढ़िया सा स्ट्रॉबेरी शेक, और पेट शुगर पे भी बढ़ गई है तो पेट फिर से बढ़ गया. So that is where you have to be. We cannot move away from the basic fact that जो जैसे हम बच्चों को पढ़ाते हैं कि भाई अगर आपको अंग्रेजी और मैथमेटिक्स अगर और हिंदी आपको अगर आपने बेसिक्स नहीं सीखे हैं तो आप भले कितना इंजीनियरिंग कर लो, कितना आप काम कर लो, you will not be able to get away from that.
You have to stop fooling yourself.
So you have to stop fooling yourself. Draw up a plan. Sit down. Today I am going to think about my health. What do I need to do for my health? What do I need to do for my family's health? What are the steps we are going to take? Prepare a business plan. This is the business plan, and give incentives. So for children, the best is to give incentives. Okay, if you don't eat junk for 2 weeks, we are going to watch a movie. Not that if you don't eat junk for 2 weeks, then we'll go to Kentucky Fried Chicken. But we are going to watch a movie. To yourself, the incentive, by control diet and lose 15-20 kilograms in weight in a year, I'm going to go for a nice vacation and spend all that money that I spent on my alcohol and smoking and everything else onto a very nice beach vacation. So you can give yourself incentive, you can give yourself incentive.
Is it okay to binge once a week?
That's what I'm saying. So binging is never good. But you can have your your poison, whatever your poison might be, once a week, if you control yourself 6 days a week. And that gives you more satisfaction. I mean, for example, I like wine, okay, but I have wine once in 15, 20 days, once in a month sometimes. But then when I have it, I really enjoy it. If I was having it every day, it would lose its flavor, it would lose its luster, it would lose its, the enjoyment that you get out of it. So I think that is the important thing to remember, that it's not that you have to become a saint and you cannot enjoy anything at all. Enjoy things, but also make the things more enjoyable. So you can have a nice grill at home and you can grill your meat rather than ordering a Kentucky Fried Chicken takeout or a kebab takeout from the next door dhaba. So you can have whole wheat food, bread, instead of having maida. You can celebrate with roti and sabzi and raita with a nice spices. The advantage we have in India is we have spices. And spices, excess spices may do some harm, but in the normal amounts, the spices are fantastic. They add a lot of taste to food which will otherwise become very drab without fat. So we have spices. We can beat the Britishers especially, and more so Americans, on that we have spices. We can spice up our food. And there is no harm in using things to make your food taste better.
Sir, is there any way to get rid of smoking?
Yeah, all here.
Yes.
I mean, there are medicines that can help
My
you.
son is doing it and doesn't listen to anything.
He needs to see one patient die of lung cancer or esophageal cancer. He will listen next day. I have a friend, very close friend, who had been telling for 15 years since I've known him, please quit smoking, please quit smoking, please quit smoking. He didn't. Now he has esophageal cancer, metastatic, all over the place. All his close friend circle have quit smoking now.
सर सोच बदलने की
Sir,
जरूरत
can I ask one question, sir?
How to control insulin resistance? Any food supplements?
The food supplements are not going to work. So basically what works is cutting out the concentrated sugars. Exercise is the one thing that improves insulin resistance. Food supplements are all claimed to increase that. None of them actually work very well for insulin.
Role of some minerals like chromium and all.
Zinc
Selenium.
has some role, chromium may have some role, but again that's not going. I mean that might hit it at the edges. आपको ये तोड़ना है अगर तो उसको थोड़ा जल्दी आप मदद कर दी. लेकिन अगर आपको पूरा dismantle करके दोबारा बनाना है, you need something more drastic.
So why do cancer patients have fatty liver?
Not all cancer patients have fatty liver, number one. Number two, I don't think that's a fact actually, cancer patients have fatty liver. That's really not a true fact. So, like if you have 100 people here and 3 of us develop cancer, and out of 100, 70% have fatty liver, let's say. So, out of those 3, 2 people will have fatty liver. So, it is not that the incidence is higher. Sometimes when there is very rapid weight loss, you can develop fatty liver. So, after bariatric surgery, sometimes there is very rapid weight loss. Then sometimes people do develop fatty liver for a while. So, we also advise patients that the weight loss should go like this. It should not go like this. So, many of the diets at one point when people tried very drastic diets and lost a lot of weight, but then fatty liver increased.
So after cancer treatment, then they can come back, as you have told, with exercises.
Right, absolutely.
Okay, thank you.
So what is the stage of insulin resistance?
So insulin resistance is sort of partly genetic and partly it increases the more fat we deposit in our body, the insulin resistance keeps increasing because the cells which have fat in it are more resistant to the action of insulin. So that is why losing weight and exercising improves the insulin resistance significantly. It decreases the insulin resistance because the cells become more sensitive to the same amount of insulin.
So, I have one question.
Mhm.
When you just start to have raised levels of blood sugar,
Right.
so your doctor probably advises to change your lifestyle and then not start medication. But do you think you should switch to medication since it also helps fatty liver?
For diabetes, you mean?
Yeah.
Yeah, I think with diabetes, our thinking has changed significantly. That I think very mild elevations of blood sugar, yes, lifestyle modification as the primary therapy. If there is slightly higher, if you actually have diagnosed diabetes, your blood sugar levels are at that level, that it's a diabetes, clear diabetes, then it should be treated medically. And in addition, with the lifestyle modification, there are some patients who are then able to come off the medication 2 years down the line for a period of time and then may again require medication down the line.
It has spurts in blood sugar levels, like for a month it's high and then for 4 months it's normal and then again high. So
Then you should be on medication.
medication.
you should be on regular medication.
So what are the symptoms of fatty liver?
There are no symptoms, that's the problem.
How can a layman know that his liver is getting fatty?
Yes, so number one, just measure your weight and your height, calculate your BMI. I don't have the chart, but if you go to any doctor, in the office I have a chart which says what's your height, what's your weight, and we look up on the chart and say this is your BMI. So if your BMI is more than 23, you have a fairly high chance of getting fatty liver. Number one. Secondly, yes, especially, I now recommend that at below the age of 40, you should have routine testing at least once in 3 to 5 years. After the age of 40, maybe every 2 years, have routine screening, simple things like ultrasound, simple blood tests, that will tell us.
Liver function.
Yeah, liver function.
Sir, one thing.
Yeah, go ahead, please.
जो अल्ट्रासाउंड होता है
Yeah.
तो उसमें अगर जो फैटी लिवर होगा तो it will be mentioned definitely.
Yeah, ultrasound is able to pick up. It's a sensitive test for fatty liver.
Means the report will definitely mention if it is fatty liver.
Yes.
मेरा पहले 2 बार आया, उसके बाद पिछले 3 बार से नहीं आ रहा है, तो इसका मतलब फैटी लिवर ठीक हो गया?
कम हो गया. अल्ट्रासाउंड इज इसका हम कहते हैं सेंसिटिविटी एंड स्पेसिफिसिटी, दो चीज़ें होती हैं. सेंसिटिविटी का मतलब है कि अगर आप 100 लोगों को फैटी लिवर है तो उसमें से कितने लोगों को अल्ट्रासाउंड पिकअप कर लेगा. तो इसकी सेंसिटिविटी अच्छी है, अबाउट 70 to 80% सेंसिटिविटी है, लेकिन इट इज नॉट 90 और 100% सेंसिटिव. आई वुड से 80% सेंसिटिविटी. स्पेसिफिसिटी होती है कि अगर किसी को फैटी लिवर नहीं है तो अल्ट्रासाउंड नॉर्मल है, RB 100% श्योर की फैटी लिवर नहीं है. स्पेसिफिसिटी उतनी अच्छी नहीं है अल्ट्रासाउंड की. ठीक है, सो दैट इज नंबर वन. सो एनी टेस्ट दैट वी डू हैज इट्स स्पेसिफिसिटी एंड सेंसिटिविटी एंड लिमिटेशंस. So, अगर 2-3 बार में नहीं आ रहा है, then at least की fatty liver may have gotten better. You may have made some effort to get
Yeah,
it
I
right.
have made.
Yeah. So that is why your fatty liver is better. So ultrasound is a good test for a routine follow-up
Is
screening.
there a better test?
No, there is no single test. So liver blood test along with ultrasound is probably the most widely available and easy to do tests. If we have to actually quantify it, then the next test we do is fibroscan. And other things if we have to quantify further, then we say okay, we do MR spectrography and all that, but those are expensive then.
This fibroscan how a person qualifies to get the fibroscan?
Right. So the question that we have from the audience is who needs a fibroscan? How do you qualify?
And what is the cost?
What is the cost? So the fibroscan basically is a machine that sends signals into the liver and measures everything that is reflected back. Okay, so it's like a Doppler in a way, but it's not exactly Doppler, but that is the way it actually measures. So it sends ultra high frequency waves and then sends it back. So जितना ज़्यादा stiff होता है liver, उतना ज़्यादा reflect back करता है. So that is how it is measured. So fibroscan is indicated to certain extent to diagnose advanced fibrosis or cirrhosis, or to exclude. So at the lower end of the spectrum, कि अगर fibroscan level बिल्कुल normal है, so then the chances are that there is no fibrosis or scar tissue formation in the liver. It doesn't tell you that there is no fat in the liver. It doesn't give us a measurement of the fat. It gives us a measurement of the fibrosis or scar tissue formation. और अगर बिल्कुल दूसरे end of spectrum में आपको fibroscan readings are more than 12, 13, 14, then you have a very strong correlation with cirrhosis. जो बीच की window है, उसमें there are variations. So it is not as effective. So the usefulness in fatty liver setting for fibroscan is to do a fibroscan now. Suppose the fibroscan reading is 5 today, and do it again after 3 years, and then see if it has remained at 5, has it gone from 5 to 3, or has it gone from 5 to 10. If it's going from 5 to 10, we are worried, because then that means scar tissue formation is progressing. So that is where we are using fibroscan for. The cost of the fibroscan varies from hospital to hospital, but anywhere from 4,000 to 6,000 rupees generally. Some places are doing it for 3,000 I believe. We are not routinely doing it now, but we are getting equipment now twice a month. We are going to start doing it, and then the equipment is expensive. So basically, hospitals that well, this is about 1 crore. So when people, any hospital invests into fibroscan or any doctor, they say what is the return on investment, like in an industry. So for that reason, some hospitals will have it, some hospitals will not have it. But at the same time, the indications are, if you are suspecting cirrhosis, if you want to follow up a patient, उसको fibrosis कितना हुआ है उसके लिए, and the cost is anywhere from 3,500 to 5,000 I think.
Doctor, no, sir. 2 questions.
Let me just complete that. Come to you.
If a person has this liver, fatty liver, but his liver function tests are normal, so does he qualify for, or his appetite and all that is normal? Does he
qualify for getting that fibrosis scan now?
Right. So if you have fatty liver or ultrasound, for example, and your liver blood tests are normal, and then you have two options. One is we do a fibro scan now, which will most likely be normal or will be in the normal range. And then again, as I said, the importance in fatty liver is when we do it progressively. As a single step, it may not give us too much in terms of what we are going to do about it. But if you look at it progressively, then you will know कि suppose you do fibro scan now and आपने कुछ change नहीं किया, अपने diet and कुछ नहीं किया, 3 साल बाद आपका fibro scan has actually worsened and now it is showing कि fibrosis हो रही है. Then you might be more inclined to make changes. The other thing is आपने सारे changes कर लिए, उसके बाद fibro scan is unchanged, that or improves, then it gives you incentive to continue doing more. So that is the role in the other extreme is that we are suspecting somebody has fibrosis. We are suspecting that based on blood test, albumin levels कम है, INR बढ़ा हुआ है, क्योंकि liver के blood test कोई भी specific single blood test ऐसा नहीं है जो typically हमको कह दे कि fatty liver है या fatty liver नहीं है, कोई single test ऐसा नहीं है, और यही हमको कह दे ये fat की वजह से ही है, किसी और वजह से नहीं है, तो बाकी चीजें exclude करते हैं उसमें कि hepatitis B, hepatitis C, alcohol, some uncommon conditions, Wilson's disease, hemoglobinosis, ये सब exclude करते हैं पहले, फिर हम कहते हैं अगर वो सब कुछ नहीं है और अल्ट्रासाउंड में fatty liver दिख रहा है तो इसका मतलब ये fatty liver की वजह से है. आप
grade 1 liver, fatty liver, grade 2 में difference number 1. Number 2, अगर grade 1 liver fatty है, तो क्या reversible होगा ये process में?
So दो questions हैं यहाँ पे कि what are the gradings, grade 1, grade 2, grade 3 fatty liver और reversible है कि नहीं है, अगर grade 3 पे पहुँच गया है, grade 2 पे पहुँच गया है. So पहली बात तो कि the grading is ultrasound criteria होते हैं. I'm not a radiologist, so I can't tell you exactly. But basically अगर it's like anything else कि आपने कहा कि भाई थोड़ा मोटा है, ज़्यादा मोटा है और मोटा है. So it's a question of that, but they have definite criteria on ultrasound कि अगर इतना उसकी reflectivity in the liver is same as spleen, then it is grade 1. If it is more than spleen, then it is grade 2. If it is significantly more, then it is grade 3. That is the broad one I know. But then they also have criteria कि मैं 3 जगह 4 जगह अगर स्कैन किया है तो उसमें से वेरिएबिलिटी कितनी है, अगर यूनिफॉर्मली हेपारोएकोइक है, ज़्यादा रिफ्लेक्शन आ रहा है उसमें, ज़्यादा वाइट दिख रहा है, then it is grade 1 और grade 2, और अगर बहुत ज़्यादा आ रहा है तो grade 3. अगर लिवर का कंटूर ऑल्टर करने लगता है, इरेगुलर लिवर सरफेस है,